So I'm going to start the recording now. This conference is just to do an overview over the NCCT website, what it is, and why it's in your courses. So our weekly course material conference is actually going to be tomorrow, and you'll notice that it is scheduled at different times each week. So you'll have one conference that will focus on NCCT, and then you'll have another conference that will focus on the course material. So my name is Professor Bennett, and I will be your facilitator for this session. So just to give you a little background on the NCCT, they are a national organization. They actually provide credentials to healthcare professionals. And they have all different types of certifications, including the medical billing and coding, and they have also some other ones as well. But we're just going to focus on the one for the medical billing and coding program. So they've been around since 1989. So this is just one of several organizations that give certifications. So this is just the one that when you are in your next to your last class, you're going to actually take this exam as part of your class. So I believe it is MBC 2805. You're going to actually take your exam in that class. And then the class after that is your externship. So just wanted to point that out. We're actually starting to go over this now because some students are going through the program and not really understanding what is NCCT, that they're going to actually take it in that class, MBC 2805, and that's the reason why each week you have, I'm sorry, not each week, but each class in week 4, you have an assignment to do on that actual website. So if you haven't been doing them before, you still can go back and go and do the ones that you missed. But the reason why we are having students do this is it is to prepare you for that actual exam. So just want to give you a little bit of background on it and what it's all about. So we're going to kind of go through it now. So the name of the certification that you're going to get is going to be the Insurance Coding Specialist Certification, the NCICS. So that's the certification that you'll be getting at the end of your program. But that's not to say that you are not prepared to take other exams as well. This is just the one that comes with your program. So just to give you some background of what's actually on the test, you're going to have actually 100 questions. 25 of them will be unscored, and you'll be allowed 3 hours for that actual exam. Now, it sounds like a lot of time, but in a lot of these certification exams, you have to know your CPT, your ICD-10, and your HCPCS manual, because if you're not using them while you're in your classes and then you just go and take the exam, it'll make it a little bit more challenging. So once you get your coding manuals, make sure that you start using them and not only using the different websites that you can use that have the encoder on there. So this is why you want to do that, because the 3 hours will go by pretty fast, especially if you have questions where you need to look up both CPT and ICD-10. So these are just some things just to think about as you're going through your program. So these are the sections that are going to be on the exam. It's going to have medical insurance, medical billing. It's going to have collections, the claims process, coding, and then law and ethics. So these are the different, sections that you'll be tested on. So in the medical insurance section, there are going to be questions about verifying the patient's benefits, determining the order of billing based off of the birthday rule, and you'll learn more about that through your program. Also, you'll learn about primary and secondary insurance. You'll learn more about authorizations, pre-certs, predeterminations, and referrals from the primary care doctor. So these are just some of the things that they're going to cover on the medical insurance part. You'll also get questions about completing and submitting claim forms, about workers' comp, also about the different insurances such as Medicare and Medicaid. So those are going to be your government programs. You're going to get questions about explanation of benefits, coinsurance, deductibles, be able to answer patient account inquiries. So that's when a patient calls in and they may have a question about their benefits. So that's why you'll have to, remember things about benefit plans, how to submit an appeal, understand claims for auto carriers because that could be slightly different. Some of their rules may be a little bit different. Also, claims for personal liability insurance. So, like if a patient, let's say they had an accident and it happened, in a store or somewhere like that, that would be considered like a personal liability. So, lots of information as you can see. They also talk about the EMR, the electronic health record, also maintaining billing databases. So when you get into certain classes, when you're doing the EHR, take the time, go through the course, use the um, EHR that they have so that you can get, practice with using it, not only for the exam, but also for once you start actually working in the field. So that's a great, opportunity to prepare you for that as well. Also, the charge capture using an encoder. And basically, the encoder is like on the AAPC website. You have access to codify. So that's what we call an encoder. Also, verifying codes and then also understanding different templates for your EMR and your EHR. So I'm kind of telling you these things so you'll know as you're going through your program, things that, may come up on the actual exam. Now, as you start getting closer towards the end, they do have review classes and things like that that may be offered. So these are just things just to think about. And then in this course, you have some videos that I actually put out there in the announcement section. Um, they also will give you some more information about things that you may need to study and to work on. You'll also get questions under the collection section. And this is where you're going to explain the financial policies and procedures of a practice, collecting the co-payment and the co-insurance and the deductibles, actually posting the payments, posting payments to the financial records, the EOB again, how to actually post it. So that's actually when the payments come in from the insurance company, now you have to post it to each individual patient's account. So it's actually doing that, handling denied claims. So, for example, if a claim is denied, how would you write the collection letter? What are things that should be included in that letter? Things like that. So again, you'll learn that throughout your courses, but these are just things that are, again, that are going to be on there. They'll talk about rejected claims. So these are claims that we tried to submit to the insurance company, but before they actually got there, they denied them. So we have to actually correct them and then resubmit them back. How to manage your AR, and that's your accounts receivables, and that's for your patient and your insurance. Also, how to manage patient statements and bills. Also, your patient payment arrangements. So you'll have some patients that may call in and say, I'm unable to make, my full balance that I owe. Can I set up payment arrangements? If there's any overpayments, how would you handle those? These are the ones that are from the patient or the insurance company. So how would you handle those? Preparing financial reports, processing credit card transactions, explaining bill statements, managing accounts, that go to collection agencies. So each place handles those differently, but you're still going to manage that AR the same way. A lot of companies just write it off. Some of them sell it. So it just depends. But how you're going to handle it um, is basically going to be, how you're going to handle that AR that's left on the books, adjusting any patient account balances. How are you going to handle no shows? So those are your patients that have appointments, but they don't keep them. So some offices actually track those. So they'll go in, they'll put a little code in there that says the patient no show. Also, it will be posting payments to the patient's financial records, managing accounts that have hardships, so patients that are unable to pay. You shouldn't see a whole lot of these, but you may get some checks that were returns for non-sufficient funds. But a lot of offices have gotten away from that. They usually have the patient use the debit card so that they don't have checks returned to them. You have another section, which is your claims processing. So as you can see, if you haven't noticed, there's a lot of material that's on these exams. So for example, in our class in week 4, you'll have an assignment where you're going to go out to the NCCT website and you're going to do an assignment out there. So as you're going out to that website, completing those assignments, that's actually preparing you for your actual exam that's going to be in NBC 2505. I think that's the number, 2505. Um, so it's actually preparing you for that. So that's why you want to start doing those assignments if you haven't been. So we're actually doing this now in each of our classes, and actually is in week 3 in this class. It's the assignment 3.2 where you're going to do that interactive. So for example, this class is ICD 10. So when you do your interactive, it's going to be related to ICD 10. So it'll be just that section. So when you go to your next class, so let's say if it's CPT, when you do that part of your pre-test, your preparation, it'll just be on CPT. So under the claims process, there'll be questions about obtaining signed documentation for financial responsibility, obtaining information on submitting clean claims. And so that's claims with no mistakes on them. We want them to go to the insurance company and not be rejected, seeing if they have medical necessity and things like that. So you'll learn more about that. I believe it is in NBC 1405, where you'll learn a lot more about the claims, the CMS 1500 form, how to complete it, what it is, who uses it. So you'll learn all that information in NBC 1405. Also reconciling your financial transactions, fee schedules, entering charges, capitation, and applying those payments. So your managed care insurance companies, they have the capitation plans, and then also financial reports as it relates to claims management. So you'll have your AR reports, you have monthly reports. So it'll be different reports that you'll have to run at the end of each month to close out from one month to the next. So again, most of this claims process will be in NBC 1405. Now, so for our class, which is ICD 10, and we'll go into a little bit more each week, So in the ICD-10 section, they're going to ask you questions about abstracting data from the medical records and then assigning the correct ICD-10 code, sequencing the codes, that means putting them in the correct order, applying the ICD-10 guidelines, and then also determining when you should code for signs and symptoms. So, and we'll go more into that when you should just code the signs and symptoms, because sometimes you may not have a diagnosis. Patient may come in and the doctor says, rule out chest pain, rule out pneumonia. That's a better example. Rule out pneumonia. Excuse me. Sorry about that. I had choked a little bit. Um, so if the patient like came in for let's say that they had chest pain, so the doctor might send them to get a chest x-ray and say rule out pneumonia. So you can't give them pneumonia, you'll just have to code the chest pain. So that's the sign and symptom. So that's what they mean when they say signs and symptoms. But we'll get into that more because this is ICD-10 class, but I'm just giving you some examples of, you know, things that may come up on the exam. So you'll also have HCPCS coding. So when you get your books, you should actually have three three books: ICD-10, CPT, and HCPCS. So all three. If you don't have them, make sure that you look into your FTC email and that they'll be sending you something from the AAPC to verify your address. If you don't verify your address, they're not going to mail your books. So make sure that you mail your address back. So check your FTC email, not your personal email, the FTC. You don't want to wait until it has happened. You get to the last class and say, "Oh, I don't have my books." Well, how are you going to take your exam if you don't have the books? So make sure that you get your coding manuals, that you put your address in there, and that you receive your coding manuals. Now, if you just did it this week, let's say Monday or today, give it a few days, give it to the end of the week, and you should have your book. If you don't have it yet, you still can do a lot of the assignments. Um, you should have access to AAPC now, so you'll be able to use the encoder there. And then a lot of the questions are in your ebook. So I know that the Cengage website is down right now, but as soon as it comes back up, it's in your ebook. And then if you haven't noticed in the announcements, I have videos there that will cover a lot of the topics, and then also in our discussion. So make sure you get your books at all costs. So, like I said, one of the books is going to be your HCPCS. Now, HCPCS is very similar to CPT. So, you'll be getting questions about abstracting data and then assigning the codes according to the HCPCS guidelines, and then also your um, modifiers. So, your HCPCS modifiers. So, you'll learn more about HCPCS in your CPT class. So they kind of go over that. They don't spend a lot of time on it, but it is in the CPT class that you'll learn more about the HCPCS. It's not a whole separate class. So in the CPT, you're going to be tested on, looking at a medical record and then assigning the correct code, the CPT code, reviewing the guidelines, and then applying those guidelines before you assign the code to make sure you're assigning the correct code, and then modifiers because CPT has modifiers and then HCPCS has modifiers. So those are two different sets of modifiers. So they'll be testing you on both. And then you'll also get some questions about law and ethics. So you'll have a class that'll cover law and ethics. So they'll talk about like fraud and abuse, the different laws. Some of them, mainly, they're going to focus on the federal laws because every state has different laws. So they'll focus more on the federal ones. And then any regulations, as far as it go with the insurance, billing, or coding. And then also the scope of practice, so what you can do, what you can't do as billing and coding. And then also um, any other laws related to medical billing and coding. So they'll focus mainly on those because that is the exam that you guys will be taking. So I'm gonna share my screen with you to show you some of the different sample questions that they actually that are actually going to be on the exam out of these 100 questions. So you'll have multiple choice, hotspot items, drag and drop, and then multi select items. But I'll show you what they are. I thought it would be easier if I just show you versus me just um, having them here in a PowerPoint. So I'm going to actually share my screen. Okay, so you should see my screen now. And so here's a multiple choice question. So just your standard multiple choice, your question, and then you'll pick a question. Now the hotspot, these are items that will include like things with graphs on it. I don't know how much they're gonna put this on there. I don't think it's gonna be a lot of them, but this is what they're referring to when they're talking about hotspot um, items. Now you will see the drag and drop. So those are like matching. So they'll have maybe they might have the answers over here. So, and they might have like the terms and definitions over here. So you'll just drag and drop to what they actually mean. So that's what they mean when they say drag and drop. So you might have some of those. And then when they say multi-select, it'll be these type of questions here. So like, which of the following cleaning tasks um, after a procedure may be the surgical technologist be responsible for? And then you'll just click on the ones that they'll be responsible for, and then you'll leave the ones out that are not applicable. So that's what they mean when they're describing these different types of questions that may actually be on the exam. So I figure it would be easier for me just to show you exactly what they're talking about. Okay, so that's to give you that's a general broad overview of what to expect on the exam. So this is just to, get students to make sure that you're doing those, you know, assignments that are assigned from the NCCT website in each of your courses. Because again, that's what's preparing you for your actual exam. So this is the exam that the college actually gives. Now, can you take, let's say, the CPC, CCA, or some of the other exams? Yes. They're just not a part of this program that they're going to actually pay for the exam. But they're using the same books, the same material, everything. Your material is actually the same. You just have to go and set that up on your own. Now, the college will set up this particular exam. But if you want to take any of the others, then you'll have to work and set them up yourself. And if you are interested in taking some of those other exams, I suggest, so for example, if you know you want to take the CPC, I suggest that you join the AAPC and you do it as a student because it's cheaper for your membership if you join as a student. If you want to do it through AHEMA, which they do CCS, CCA, CCSP. So if you want to do one of those, then, and that's later on, join as a student because the fees are actually cheaper to join as a student versus if you're not a student. So that's just what I recommend if you want to do some of the others. You can have multiple certifications. I know people that have 5, 6 certifications from different um, organizations. So I know people that have one from this organization here. They have one from, AHEMA and one from AAPC. So you can get one from all of them. So it's not unusual. People would just go ahead and get the other certification. So if you're thinking about any of those, I mean, you have almost a year while you're in your program. So maybe you might want to plan it out if you know you want to join one of those other ones because they can get very expensive, um, the fees for joining. But this particular one that I just went over, there's no fees here because that's actually you're going to actually take it in NBC 2805. Okay, so we have a question. I did pay for the exam 100 question and answers from the AAPC website. If you want to tell them, I don't mind emailing them the questions and answers that will be on the test. You guys can get together privately and do that if you want to. I'm just focusing on um, this particular exam. That's great that you took the initiative to do that. And if I was interested in that exam, I would have did the same thing. So if you are interested, then please, I suggest that you join as a student. Okay, any other questions? And I'll just point out again while I wait to see if anybody submits any questions, is that um, this is not our conference for the actual class. This is just for NCCT. Okay, well, if you guys don't have any other questions, that's going to conclude our session for tonight. If you guys have questions later, please feel free to email me, and I'll be more than happy to answer any questions that you may have. So I'm actually going to stop the recording, and I'll stick around for any other questions. So thank you for joining. Okay, so I don't see any other questions. I just want to point out that in the announcements under helpful videos, there is actually a video that actually covers like a prep to doing the actual exam. So it's like a review of all of the different areas. So we have that available as well. And if the link is not there, I will make sure that I add it in for you guys so that you're able to see the video that kind of gives an overview. So what it is we used to do an overview like a prep to get you ready for the exam. So I'll share that link with you as well to just show you some of the things that we do. So it's like questions and answer sessions and things like that to kind of prepare you for the exam. So I can share that with you as well. So I'll add that link in if it's not already there on the announcement section of the class. So again, that's all that I have, but I just would like wanted to let you guys know, what are some of the things that you can look for as you prepare for your exam. So thank you for joining, and I'll see you guys on a discussion. Have a great week.